Hi, and welcome back to another episode of the Longevity Lab. I am Dr. Tariq Kader, and today I'm going to talk to you about one of the issues I see a lot with the use of weight loss drugs, or GLP-1s, and that is hair loss. Weight loss drugs, also known as GLP-1s, they have been around for quite a bit of time. In fact, the first agent was approved by the FDA for the use of diabetes in 2005, and another one was approved in 2014 for weight management. Since then, overwhelming evidence continues to surface suggesting that tremendous health benefits could be related to the use of GLP-1s. And these benefits are not necessarily related only to weight loss and fat loss, but there are other aspects as well, like anti-inflammatory properties, cardiovascular protection, autoimmune disorders, even gut health issues like dysbiosis. But are they being misused or overused? In my opinion, yes, absolutely. At the end of the day, these are medications, these are drugs, and they should be treated as such. They can develop significant side effects or unwanted outcomes, and this always has to be supervised. Now, today we're not going to take a deep dive into indications or contraindications and what to expect from GLP-1s. We're going to talk about one specific one that I see very commonly, actually, which is hair loss. I've been utilizing GLP-1s in my treatment protocols for many years now, and I have seen tremendous success. But at the same time, doing so for many years, I have seen all sorts of side effects. But there is this one side effect that stands out, which is hair loss. In my practice, we ran the statistics and we found that 30% of women who were started on GLP-1s would report an increase in hair shedding compared to prior to starting the medication. And of course, this is frightening. And I frequently get these emails, text messages, or phone calls, sometimes with a panic that, am I losing my hair? Am I going to be bald? And the short answer is no. So we took a deep dive into the available studies, and hair loss is a well-documented side effect. And there's also agent variation, means that some agents are causing more hair loss than others. Now, the good news is that the majority of this hair loss is typically temporary. The American College of Lifestyle Medicine and the American Society of Nutrition and the Obesity Society, they jointly stated that hair loss is a recognized side effect of GLP-1s, but it's more commonly seen with more rapid weight loss rather than a direct toxic effect of the medication on the hair follicle itself. This pattern is consistent with a condition called telogen efflavium, which is a reversible form of hair loss triggered by an acute physiological stress. Now, you may be loving what's going on with your body with the use of these medications, but to your body, this amount of weight loss in a short period of time can be very stressful. And to try to simplify the hair cycle here, the hair cycle has three phases. The anagen phase, which is the longest phase, and the majority of hair sits in that phase. Second is the catagen phase, where the hair growth stops. And the third phase, which is the telogen phase, and this is where the hair sheds. Now, the telogen phase is temporary, and in the presence of the right environment, the hair will cycle back into the anagen phase, the initial phase, and the hair will start growing again. But under stressful situations, whether related to cortisol spikes, cytokine activation, or mast cell activation, the hair follicles will prematurely end the anagen phase and enter the telogen phase. As I stated at the beginning of the video, GLP-1 use should always be supervised, like any other peptide, and ongoing nutritional counseling should not be optional. Now, as the appetite is reduced and the total calorie intake is reduced, there's a much higher chance of developing micronutrient deficiencies. Now, today, a lot of the quote-unquote nutritional advice focuses mainly on macronutrients, which are protein, fat, carbs, and fiber. And they overlook things like micronutrients, nutritional density, and the quality of the food. Now, combine a very low appetite, misinformation, or bad advice, and eventually a reduction in food intake, you will inevitably develop some sort of nutritional deficiency, which through different pathways will lead to hair loss. Nutrient deficiencies mostly associated with hair loss are B12, iron, magnesium, calcium, zinc, and folic acid. A lot of the times, testosterone is coupled with GLP-1s, but without diving into too much details of testosterone use, the first question I get in this case is testosterone causing my hair loss? And the answer most likely is no, because there's no compelling evidence out there to suggest a strong correlation between testosterone use and accelerated hair loss in women here we're talking, especially in non-supraphysiological doses. Now, how do we address these issues? First, you have to talk to your doctor if this is the right medicine and the right fit for you. Not everyone who wants to lose some weight would need to use GLP-1. And it's not meant to be a shortcut for weight loss. Yes, Yes, it is an amazing invention. Yes, it helps so many lives and it should always be on the table, but the use should always be supervised. Rapid weight loss is very common at actually higher doses, and it's not necessarily a good thing. So, you should have a discussion with your doctor and set a realistic expectation and set a reasonable rate of weight loss over the next few months. At our practice, for example, at Naples Longevity Clinic, we always talk about these expectations, but we always check for micronutrient deficiencies, especially when issues like this arise. And after we hone them down, we sit you down with a nutritionist and you hash out the diet again and again and readdress nutrient dense foods and then talk about specific supplementation, whether orally or through the IV. So, if you're noticing hair loss while you're using GLP 1s, try not to be alarmed and talk to your doctor. Find a good dietitian if you need to, and prioritize foods that are nutrient dense and watch these hair follicles grow hair again. If you liked this video and found it useful, hit that like and subscribe button and share it with someone you think might find it helpful. See you next time.